Hello, Mr. John. Good afternoon.
Good afternoon.
How are you doing today?
I'm good, and you?
I'm fine. My name is Antonia Osho. I'm a student of Perryville College of Nursing. I've come to do your health assessment today, and is everything okay?
Yes, ma'am.
Okay. Please let me wash my hands. I'll be back. Hi, Mr. Joe. Please can you verify your name for me?
Yeah, my name is John Osho.
Okay. And your date of birth?
March 4th, 2003.
Okay. Do you know where you are today?
Yes, ma'am.
Okay. Do you know today's date?
Yes, ma'am.
Okay. And your name? And you know your name? You know today's date. So my patient is Alas, is oriented, and is Alas times 4. He knows today's date, and he knows where he is, and he knows his name, and he knows it's related to person, to place, and to time. Thank you. So today we'll be doing assessment on your thorax, your cardiac, peripheral vascular, and your abdominal. So before we start, I would like to ask you a couple of questions. Do you have difficulty breathing?
No, ma'am.
Do you have chest pain?
No, ma'am.
Do you cough?
No, ma'am.
Do you have any pain or difficulties while you are breathing?
No, ma'am.
Do you smoke?
No, ma'am.
Okay. Concerning your abdominal, do you have abdominal pain?
No, ma'am.
Okay. Do you have like a change in the pattern of your eating,
No, ma'am.
like your eating habits?
No.
Okay. And do you have difficulty using the toilet?
No.
When last do you have bowel movement?
Yesterday.
Thank you. So now we can now proceed. So please, I'll be touching you with my hands, and I'll be touching you with my stethoscope. Is it okay?
Yes, ma'am.
Thank you. So now we're going to start with the posterior thorax. After that, we'll come to the anterior. The posterior is the back. So the first thing I want to do, I want to inspect the characteristics of the skin, the contour, and I see that the skin is consistent with the ethnicity of my patient. And now, the skin has no lesion, no drainage, no wound, no scar, and the skin is intact. And I look at the slope of the ribs. It slopes down, and at the angle of 45 degrees. So, which is a normal finding. Sir, can you please touch your chin to your chest for me? Okay, I just want to identify your vertebral prominence. If I touch it, do you have any pain here?
No.
Okay, thank you. So, and I'll be running down the middle of your back, which is your vertebral column, and I will be feeling, do you have any pain?
No.
Feeling for pain, feeling for tenderness, and any mass.
No.
Do you have pain?
No.
Or that is your vertebral column. So the vertebral column is located at the middle of the body, and that let me know that the posterior thorax is symmetrical. Thank you. So now I'll be palpating your posterior thorax. Can you please turn your back to me a little bit? Thank you, sir. Please, when I touch you, tell me if you have any pain or you feel any pain. Do you feel any pain?
No.
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 Thank you. You can raise your body up. Thank you, sir. Now, I want to palpate your Titani fremitus. So, when I touch you, please say 99.
Yeah. 99.
Okay?
99.
Okay.
99. 99. 99. 99. 99. 99. 99. 99.
Thank you. I'm now Titanic fremitus is present over the lungs field as my patient said 99. I felt the vibration in the front of the scapular bone. Now I would like to palpate your expansion joint. So I'll be holding you by your 9th to 10th ribs. So, and I'll be pinching your skin a little bit, and I will be telling you to take a deep breath for me. So you're going to breathe in and exhale it. Okay. Okay. Do it again. Thank you. So I can say chest expansion is present bilaterally. So it is symmetrical because it expands my tongue equally. So chest expansion is present symmetrically. Thank you, sir. Now I will be percussing, and the percussing is I will be tapping it to know the sound it's going to give. So I'll be percussing your posterior thorax. Yeah, I noticed that it has a high pitch, so it's resonant. Thank you. And it's present over the lungs field. Now I'll be moving to the anterior thorax. So, can you raise your hand for me? Okay. I see that the anterior posterior to the transverse diameter is 1 to 2. Thank you. Now we have come to do the anterior thorax. Oh, but before that, I remember I'm supposed to do the voice and the posterior. Let me quickly do the voice. So, okay. So, when I place my stethoscope, the first one is going to be brocophone. You're going to say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Then now I'm going to check your ergophone and you're going to say E at the touch of my stethoscope.
E, 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 E.
Thank you. Right now you're going to do whispering. You're going to whisper 1, 2, 3. 1, 2, 3. Just whispering.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Thank you. I noticed that the sound, the voice sound at the scapula, when you say 99 for the brocophone, is muffled. And at the scapula, when you say E for the ergophone, is heard over the long field. But when you whisper, it's very faint. And we shall normal findings. Thank you, sir. Now, I've come to the thorax, the anterior thorax. So the first thing I want to do, can you raise your body for me, please? I want to check the color of your skin. I want to check the contour. I notice that the skin is intact, no drainage, no pallor, no wound, no scab. The skin is intact and the color is consistent to your ethnicity group. And checking the ribs, it slopes down and the costal margin is 90 degrees. And the mid-sternum is of course at the middle, and your anterior thorax is symmetrical. So now, having completed my inspection of your anterior thorax, I want to palpate. I will be touching you. Please let me know if you have any pain, because I'm palpating for pain, tenderness, and mass. Any pain?
No.
Any pain? Any pain? Let me know if you feel anything.
No.
Any pain? No pain. Thank you. So I notice he has no pain, no tenderness, and no mass noted at the anterior thorax. Now I'll be percussing. Then thereafter, I'm going to listen to sound and voice, also in the front. Thank you. I noticed that the sound over the long field is resonant, and which is a normal finding. Now I'll be checking your breast sound at the anterior thorax. Oh, you can take a deep breath for me, please. Just you breathing. Thank you. All right, so now we can move to cardiac assessment. So the first thing I want to do, I want to inspect, because I'm going to start from your neck. So I'm going to inspect the skin of your neck and the skin over your precordium. So from your neck, the skin is intact, no lesion, no pillar, it's consistent with the ethnicity group, and no drainage. Can you use the body for me, please? And no pillar. So the skin is intact. Thank you. Okay, and inspecting for the jugular vein. As my patient is standing, the jugular vein is not visible. Can you touch this side? Yeah, the jugular vein is not visible since my patient is sitting erect. So please, I want you to lay for me, please. Put your head on the pillow to create an angle of 45. Lift it a little bit. Okay. Okay. So please, I want you to turn your head to the other side. Okay. There I have bright light, but I just want to see. Now I can see the jugular position as my client is laying supine, and now I can see the position of the jugular vein. Let me check the jugular vein position on the other side. Okay, now I can see the position as my client is laying supine and elevating his head on the pillow at 45 degrees. Here is it. Thank you. That's the jugular vein position. Thank you, sir. Please sit up. Okay. So right now, I'll be auscultating your carotid artery, and thereafter I will palpate it. So the jugular vein, not seeing while you were sitting and seeing while you were laying supine at the angle of 45, it is an expected finding. Okay. Please. No bruise found. Now I'll be palpating your carotid artery. The other side. Your carotid artery is too close and is present bilaterally. Thank you. So then, From there, I'll be palpating your apical pulse. It's located at the midline of at the fifth intercostal, midline of the clavicle. So it's at the mid intercostal, mid clavicle. Okay, so I got it in. So it's 2+, it's strong. So the position is present. Okay, thank you. Now, what I'm going to do, I'm going to percuss over your precordium. I'll be tapping it, but I won't let it be too hard. Oh, I'm sorry. Should be from here. The first intercostal. Then the third, which is the head. Then the fourth. And the fifth. Thank you. So I percuss it over aortic, I percuss it over pulmonic, and I did the percuss in the third intercostal, which is the hedge point, and the fourth one, which is the tricuspid, and the last one at the apex, which is the mistra, the bicuspid point. And I can say your resonance sound is present. Thank you. Now, I want to listen to your heart sound. And I'm going to listen over the 5 regions. That's aortic, and that's pulmonic. Now I'm on S point. I'm at the tricuspid, listening to this heart sound. Now, at the mistra, which is the bicuspid, listening to the heart sound. So I'll be listening to S1 and S2. I want to be sure, I want to identify where I can get the loudest S1 and the loudest S2. I want to identify that S1 heart sound. At the base of the heart, and at the apex of the heart. I noticed that I heard my S1 louder at the apex, which is at the 5th intercostal, midline clavicle, mid clavicle, and I heard my S2 louder at the base of the heart, which is at the aortic region. Thank you. So, Thank you. Your heartbeat is 78 beats per minute, and which is within normal findings. Thank you. Right now, we're going to, it is regular and it is strong 2+. So we're going to move to the peripheral vascular assessment. I will be inspecting your hand. I will be checking the vessels of your hands and your legs. Is it okay? Smile. All right. Stretch it forward. Okay. I can see the hands lengthwise, they are the same. Okay. Bilaterally. The color is consistent with your ethnicity. No pallor, no lesion, and no injury, nothing noted at the expression. The color is consistent with your ethnicity. Thank you. Now I will be palpating. If I'm touching it, if you feel any pain, please let me know. Do you feel anything?
No.
Okay. Any pain?
No.
Any pain?
No.
I have to do the second one. Let me know if you have anything.
No.
Anything? Okay. Now, let me check your finger profile. So, okay. Thank you. Let me check your clumping, nail clumping. Just want to see the angle of the nail. Thank you. Thank you. And the other one. Thank you. Thank you. Your nail angle is less than 180 degrees, and which is normal finding. That means no nail clumping. Thank you. Let me do check your capillary refill. I'm going to depress the nail. Okay. Okay. The color comes back almost immediately. Okay. 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 That means the capillary refill is less than 2 seconds. Thank you. Now I will be checking your legs. You can see that. So the first thing I want to do, I want to inspect the color. Yeah, the color is consistent with the ethnicity group. No drainage, no wound, no scar, no mark noted on the skin, no lesion, no pallor. The skin is intact. Then now I'll be palpating your leg. I want to feel for pain, mass, tenderness. Please, as I will be touching you, let me know if you have any pain in your leg. I'll do first one and the second one. Do you feel any pain at the back of your leg? Do you feel any pain? Let me know. I'm palpating for pain, tenderness, and marks. Anything?
No.
Okay. Any pain?
No.
Do you feel anything? Any pain? Okay. So no pain, no tenderness, and no marks. Now, I can see equal bilaterally. Okay. I'll be checking the capillary refill of your nail toe. I mean your toenail. Okay. I'm doing the downside of your pinky toe, the small toe, because the nails is too tiny for me to touch. So I realized that the capillary refill is less than 2 seconds. That means that the circulation to your legs, they are okay, and it's within normal finding. Thank you. So now we have concluded the assessment of your peripheral vascular assessment. So we want to move to the abdominal. So please, I want you to lay flat on the examination table. Move up a little bit. Okay. The first thing I want to do, I want to inspect the skin over the abdominal, and I want to inspect the contour. The skin is intact, no drainage, no injury noted, no lesion, no pallor, but the skin color is consistent with the ethnicity. And the abdominal is flat, which is normal finding. And I can see pulsation, which is normal too. Excuse me. So I'll be listening to the sound of your abdominal, which is the bowel sound. So I'll listen in the lower quadrant, upper quadrant, and I will go clockwise. Please, I'm going to start from the lower quadrant, listening to the bowel sound. I noticed that bowel sound is present in all the 4 quadrants, which is normal finding. Now listening to your epigastric region. Yeah, so thank you. And I can see the position. And your umbilicus is located at the middle line of your abdominal, and it is inverted, which is also normal finding. Thank you. So now I'm going to percuss. What that means, I'll be tapping it. I want to listen to the sound over your abdominal. So I will just go around different locations. I'm hearing a high-pitched sound, which is normal because here is pushed up towards the surface of your skin, and the fluid and the food is down because here is lighter, so the sound is tympanic, which is normal finding. Thank you. Now I want to palpate, and I'm going to do 2 palpation. I'll do the first one, which is a light palpation. I'm going to depress just at the surface about 1 centimeter with my fingers. If you feel any pain, please let me know. Any pain? I'm just going to do 1 centimeter. It is a surface palpation, which is light palpation. Do you feel any pain?
No.
Any pain?
No.
This will let me know if you have anything right under the skin that may be causing problem or anything. or maybe like pain, tenderness, or mass. I notice no pain, no tenderness, and no mass noted at the live palpation. Now I'll be doing the deep palpation. What that means is that I'll be going in a little bit, about 5 to 8 centimeters deep. If you feel any pain, please let me know, because I'm going deep. Any pain?
No.
Any pain?
No.
Any pain?
No.
Do you feel any pain?
No.
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 This will enable me to know if there's any large organ or any mass or anything that is different from normal. So, no pain.
No.
So, no pain noted, no mass, and no tenderness. And this concludes our abdominal assessment. Thank you very much. You can sit up. Yeah, we have concluded our assessment, but I noticed that I still need to check your pulse. I need to check your pulse, your radiant pulse, and I need to feel your temperature. So, I feel your temperature in the leg is warm to touch. Feel your temperature in the arm is warm to touch. Now let me take your pulse. Thank you. Your pulse is 78 beats per minute and it's within the normal finding. And one more thing before we conclude, can you please let me check the pulse again? Your respiration is 16 beats per minute. Thank you. Now we have concluded the assignment. We did the posterior assessment, the anterior assessment, we did your cardiac assessment, and we did your peripheral vascular assessment, which involved your legs and your arms, and we did your abdominal assessment. Having completed these 4 assessments, sir, do you have any question for me today?
No, ma'am.
Thank you, and I appreciate your time, and thank you for allowing me to treat you today. Thank you.